So I got really annoyed today driving to work, and I wanted to go over how to properly use a mask as well as what type of masks to use during the COVID outbreak. First of all, we have a couple different types of masks. These are examples of two basic surgical mask types. These, as far as disposable masks, are what the general public should probably be using when they're going out and about on their daily activities. Cloth masks are currently recommended as okay by the Centers for Disease Control. Just make sure that they're a tight fit mask to wear and not some loose cloth. We're not really sure the efficacy of those, but you can use them if you have them. These two types of masks are called N95 masks. Leave these for healthcare workers. We do not have enough of them across the nation and across the world. If you find these at a store, please buy them, donate them to your nurses and doctors that are friends, or any hospital system will take them. Two reasons not to use these. One, you have to be properly fit tested to use these. Otherwise, they don't do any good, and they're probably worse than a surgical mask. Like right now, I have a beard. I cannot wear an N95 mask. I have to shave the beard to use one of these two style of masks. So if you find these, don't use these in general public. These are for healthcare workers and people taking care of patients with high risk exposure to COVID. So the first style mask, this one has two elastic bands that go over it. I see a lot of people putting masks on and rubbing their face. So these elastic bands are made so you don't have to touch your face with the mask. You put the mask on, wrap it around your ears, and then bend the nose piece over the top of your nose. The mask is not tightly sealed. It is not made to stop COVID. It is made to decrease the likelihood that you will give COVID to someone else or someone else will give COVID to you. The second main thing is I see people do this a lot, where they pull the mask down. So one, this takes your dirty hands, touches it across your face. Don't do that. Just take the mask off and put it to the side. Again, putting it back on, adjust the nose piece, and then you should be using hand sanitizer on your hands. The second mask type is a little bit harder to use. This one has ties on it. So again, take the mask, put it over, and then you will tie this one behind your head. Again, not touching your head. Pull this strap down, tie that strap, and adjust the nose piece, and then use hand sanitizer. Same thing for taking this mask off. Do not pull it down. I generally leave the top strap tied. I untie the bottom strap and just lift it off of your face. And then when you're done, again, use hand sanitizer. Other things that annoy me. One, don't go to the grocery store in gloves. Gloves are not helpful. Gloves make things worse. They don't have natural immunity built in. Two, don't wear your mask in a car. The places that we wear masks, and I recommend wearing a mask, is going to grocery stores, being in public, but not in your car when you're alone. If I'm sitting in my office right now, I'm not wearing a mask because there's no one for me to expose to. Before I leave the office, I will put my mask on to walk around the hospital, but I won't wear it just sitting alone in the car. Please post any questions and I will try to answer them for what you should be doing and not doing as far as masks are concerned and COVID.